I'll start with tinnitus, which the main message I have for everyone listening, especially physicians, is that there is something we can do for these patients. It's common that a patient will go to an ENT clinic and speak with a physician. They're hoping that's the person will solve their problem. But unfortunately, they're told, look, there's nothing much I can do for you. You just have to kind of get used to it or learn to live with it. The mechanism of why tinnitus becomes a problem for a lot of people, it's that the nervous system is almost hypersensitive or it's out of balance. So that can create this fight or flight response with anxiety and stress. Going to that doctor's appointment and then being told there's nothing you can do is literally the worst news that these patients have ever heard. So what's missing there is, hey, even though just like other serious health conditions, a lot of them actually, even though there's no complete cure for this, bringing it to zero, let's say someone has an 8 out of 10 problem with this ringing in their ears. Hey, actually, a lot of patients, when they follow the right plan and protocol, they can bring this down to a mild level, a very manageable level. And there's millions of people that have mild tinnitus that are living normal lives just fine. So that's the message, the gap that physicians need to hear. What does treatment look like for tinnitus? You asked, Stacey.
Yeah.
There's two main pillars which patients typically do simultaneously to get the best results. One is a sound-based treatment using something called sound therapy. And the second is a cognitive or more psychological based treatment. When both of those work together, slowly but surely, month by month, the patient can reduce the tinnitus level in their brain. So it's a type of brain retraining that works with the limbic system, the psychology centers of the brain, as well as the autonomic nervous system. The brain essentially learns over time that, hey, this sound that is amplifying, this phantom sound that is making louder and more intrusive, the brain can over time realize, oh, that's actually not a non-threatening sound. It's actually a benign body sensation. Actually, I can put it in the bucket. The subconscious brain decides I can put it in the bucket of it's not an important signal for Ben to pay attention to. Just like the sound of my breathing, always going endlessly, it's always there,
Mhm.
or the beat of my heartbeat, always there. The body can filter out these sensations so that they reduce their awareness significantly, and often the volume of tinnitus goes down over time too. So that's the best treatment. It often uses devices on the ears like sound therapy devices or hearing aids programmed specifically for tinnitus. There's other protocols as well, including tinnitus retraining therapy, cognitive behavioral therapy for tinnitus, as well as bimodal stimulation. So those are the approaches for tinnitus treatment today.